Sure. So today's lecture is about regarding the beta-lactam antibiotics and macrolide antibiotics. So in this lecture, we are going to briefly understand penicillin and the other beta-lactamase antibiotics, which comes like penicillin, cephalosporin, monobactam, carbamazepine, and what do you call macrolide antibiotics that could be like erythromycin, clarithromycin, and etc. And we'll trying to understand which are the drugs which is available and what could be the best route of drug administration for some certain condition, and the drugs might be showing some better therapeutic effect and the value to the patients. So first thing is beta-lactamase antibiotics. What are these beta-lactamase antibiotics are? These are basically the drugs like, say, example, the drugs what you have already known, like amoxicillin, ampicillin, penicillin. These are the which comes under beta-lactamase antibiotics. And these drugs are penicillin-sensitive drugs and the broad spectrum drug like clavonic acid combination. And we will see like the normal common term what we use like augmentin for those type of drugs, a combination of the drugs. So here, what are these beta-lactamase drugs? The drugs which has divided into few groups like penicillin, cephalosporins, carbamazepines, and monobactams. So these are the four different classes where the drugs beta-lactamase antibiotics are used. These antibiotics, like the first class of drug is penicillins. What is this penicillin? The drug itself, the penicillin is obtained from, is extracted from the modules of Penicillium notatum on Penicillium cryogenum. So this is the drug which is extracted from the bacteria. The penicillin is extracted from the molds of bacteria. The name is Penicillium notatum or penicillin. This bacteria, when it is made a culture, biosynthetic process, undergone an enzyme, it becomes penicillin. And the enzyme is penicillinase. Penicillinase is an enzyme produced by certain bacteria which can inactivate penicillin. And beta-lactam are the family of enzymes produced by gram-positive and gram-negative bacteria. The enzyme inactivates the beta-lactam antibiotics. The classification of these drugs is penicillin-sensitive penicillins, penicillinase-sensitive penicillin. So this drug is benzoxymethyl penicillin or benzyl penicillin, otherwise called as penicillin G, procaine penicillin G, and benzothene penicillin G. And penicillinase resistance penicillins were cloxacillin, oxacillin, methicillin, and nifacillin. And broad spectrum penicillins, which is used in, so here these drugs are in the form of injections. They are present in the form of injections. Okay, like this is trying to draw an injection diagram. But amoxicillin, ampicillin, and ticaracine, so this could be the drugs which is present in the capsule form or a tablet form or suspension. And beta-lactamase inhibitors. So here these beta-lactamase inhibitors are clavonic acid, sulbactam, and tazobactam. So here we have a most common combinations. The drugs, especially which is used in the dentistry, are more common drug like ampicillin and amoxicillin, and sometimes in a combination of clavonic acid. That is the most common name of a drug is augmentin. So it is amoxicillin and clavonic acid. So based upon the condition, the patient is suffering with some issues with the dental or the gum. In that case, the patient is advised or given a medication. And generally, the amoxicillin and ampicillin, which is given TID 3 times a day, okay, TID, means 3 times a day, 500 milligram dose. The amoxicillin dose is 500 milligram 3 times a day. Based upon the infection, it could be from 5 to 7 days. 5 to 7 days. The most common drug which is used for dental infections. The penicillin sensitive. First, we'll start with the based upon the classification. So first is penicillinase sensitive penicillin. What is this drug? The mechanism is basically inhibit the bacterial growth by interfering with the transpeptide reaction of the bacterial cell wall. So basically, this is showing an effect. This is showing an effect on growth of the bacteria, growth of the bacterial cell wall synthesis, and that causes destruction of the bacteria. Means the death of the bacteria might takes place. So basically, so here what it is doing, it is inhibiting the growth of bacteria by inhibiting the cell wall synthesis. What is this transpeptidation? It is a transfer, it is an amino acid which is from one of the chain to the other happen to synthesize the bacterial cell wall. Yes, this is bactericidal. Yes, this is bactericidal. So here, if we try to draw a diagram like say, suppose this is say, suppose some bacteria, and here, and this is a normal bacteria where it has nucleus and etc. And here, when we give some drug, drug D, like amoxicillin to the bacteria, what it will do, to keep the bacteria itself is having a mechanism to keep developing and growth, isn't it? Last time we have seen to cause increase in number or maybe the growth of the bacteria to self-development. So that whenever the bacteria will grow up, say suppose before the bacterial cell was smaller and it is becoming bigger, and then after this, it may get multiplication. So here, what this drug is doing, it will inhibit the growth of bacteria, and it inhibits, if I want to, it inhibits, say suppose this is the cell wall. The breakdown of cell wall would took place, say example like this. And when the breakdown of cell wall took place, all the matters which is there inside comes out. Just suppose example cytoplasm for our basic understanding, okay, a process. And then this is the cell death. Cell death means a death of a bacterial cell because this bacterial cell wall is got ruptured, okay, by a transpeptide protein, which is like inhibited. Am I clear? And this will anaerobic and requires oxygen. Okay, so this is how the proper basic mechanism that took place to show the effect. So now coming back to the slide. Open. So here, so this what we were discussing over here, transpeptide reaction and the bacterial effect, the bacterial cell wall synthesis. What is the therapeutic uses? Where it is used in? It is used in the many different infections. So here we will discuss first about the dental infections. It can use in an acute supraactive pulpalitis, pericornitis, and oral cellulitis, and necrotizing gingivitis. But due to the penicillin resistance, it is used in the dentistry is restricted. The use of dentistry because the penicillin can got resistant easily. So here penicillin is used very less or restricted uses. But whereas in the case of staphylococcal infection, this is a bacteria that causes staphylococcal infection. The conditions that can this bacteria produces pharyngitis, like here tonsils and the tonsils with the white patches, okay, and then that may leads go down to the liver and to the heart, and that creates a lot of issues. So here pharyngitis, rheumatic fever, otitis, bacterial endocarditis, meningococcal or pneumococcal or gonococcal infection like STD infections. And here the penicillin could be the drug of choice for this type of infection, like the infection which is caused by this other issues. And in the treatment of actinomyces in the case of anthrax, diphtheria, tetanus, and gangrene. Gangrene. So this is the drug is the this penicillin is the choice of drug for this infection, especially the infection which is caused by staphylococcal infection. And here, in some cases, the drug will be given for a shorter period of time, and there will be, in some cases, like rheumatic or pharyngitis, or and in pneumococcal or gonococcal and STD conditions, or like syphilis, these drugs can be given for a longer period of time. I mean, from longer period of time means it can go up to 3 years or maybe 3 months to some years. And sensitivity, what could be the adverse effect this case cause? The basic problem with this penicillin drug, the drug which is extracted or obtained from the penicillin, is that penicillin resistant sensitivity. A person, if it is not resistant, or maybe if he or she is sensitive to the penicillin, then he can undergo a hypersensitivity reaction, and this could be very much dangerous, and it can cause life threatening. So the patient may get sudden anaphylaxis or allergic reaction that may be produced, and maybe patient who is taking. So before, if suppose a patient has not taken penicillin before, then it is advisable or it is necessary to first test the penicillin dose. For a smaller dose has to be tested first, and then if suppose a patient is having an allergic reaction, then those type of drugs, the penicillin should not be given. If the patient is not having any allergic reaction with the penicillin, then giving penicillin can be continued. And here this shows allergic, that's why it says hypersensitive reaction, and which is very dangerous. It can be allergic, and anaphylaxis will be seen for 5 to 10 patients who is taking penicillin. And what type of anaphylaxis, what allergic reaction could be taken place? Skin rashes, eosinophil, neurotic edema and asthma, difficulty in the breathing, and hematuria, albuminuria means breakdown of RBC, albumin, etc., hemolytic, anemia, agranulocyte, etc., etc. And what other common symptoms, like the person who is taking penicillin and who is not having any allergic, but other than that, the patient might be having other common symptoms. So the patient who takes penicillin, like nausea, vomiting, pain, abdominal pain, and inflammation on the area where the injection has been given to the patient. Okay, so this is about penicillin sensitive penicillin. Now coming to the most common drugs which is used in the dentistry, the broad spectrum penicillins, that these are the drugs which is hydrolyzed by penicillinase enzyme. This is hydrolyzed by penicillinase enzyme. The ampicillin is the most first synthetic drug which is produced from penicillin. And here these are the drugs which is not destroyed in the GIT, but penicillinase susceptible. It is more effective than benzyl penicillin G against a variety of gram-negative microorganisms. So here about penicillin. So here, but the drug what we talked about in this previous slides, these slides, the penicillin sensitive, the normal penicillin injection, I said, this cannot be given orally, because when it comes in contact with the GI pH, gastrointestinal pH, what it will cause, the drug degradation would happen. Okay, so that's why this drug will be given in the form of injection. But whereas this broad spectrum antibiotic, this is modified structure where the ampicillin can not be destroyed. So that's why we say this ampicillin is not destroyed with gastric pH, and it is susceptible. Okay, and it is gastric acid, but it is penicillinase susceptible, means enzyme. For that enzyme, penicillinase enzyme is susceptible and more effective when compared to the other drug. The next name of a drug is amoxicillin, what we are giving more commonly, which is available in 500 milligram, and this is also there, 500 milligram. Okay, the drugs can be given like 3 times a day, okay, up to 5 to 7 days. TID up to 5 to 3 times a day, TID for both, okay, up to 5 to 7 days. Okay, and here one more thing, like suppose a patient who we can give a prophylaxis treatment of this amoxicillin as well. Now, if for an example, a patient has to undergo a tooth extraction, okay, and that patient, it is, if suppose you may have a doubt like that, patient may develop post extract, means after removal of the tooth, the post extractive condition can be the patient might get some infection. If we're having a doubt, then in that case we can advise the patient to have 1 gram of penicillin before extraction of the tooth. 1 gram means 2 tablets of 500 milligram. Okay, this can be act as a prophylaxis, okay, to avoid to get more infection or to cure or heal much better or faster. Okay, and what is this amoxicillin? The amoxicillin is a semi-synthetic form of penicillin. What do you mean by semi-synthetic form? Semi-synthetic means it is a structurally modified drug from the penicillin. It is a derivative of a penicillin which is structurally modified. Any structural modification. Say example, I have a drug, say example drug A. So example, this is like this. This is drug A. Okay, and this what I did, I have modified this drug A to A1. Okay, A1, and the structure is modified, say suppose like this. And now this drug, the modified drug A1, is more active. It's more active. So here what happened? This is the basic drug, the left one, and the right one for me is the structurally modified drug. And this drug is more active when compared to the basic drug. And this is structurally modified, the side one, side part. How can I change the color? Color. The arrow is here. Okay, so this is something which is structurally modified. So that is something. Okay, so this is something structurally modified, what I'm underlining with different color. So that is something synthetically, or it is like, it can be any, like OH group is added or methyl group is added to the structure. So this is like for basic understanding. So coming to the point, it is a semi-synthetic form of a penicillin, a close conjugate to a ampicillin, and it is one of the most common frequently antibiotic used in the treatment for dental infection. Why we are using this most common antibiotic for dental infection? Because it is affecting more. It is showing much more effect. Okay. Combination, and here we have a different combination of this amoxicillin. There is something happened bad here. Two times. Okay. So here, with the combination of this amoxicillin, we have different composition conditions. Like amoxicillin, when it is combined potassium clavonate potassium, it protects amoxicillin. So what happened when it is come in combination form? Why we use, now the first question is why we need, what happened when we combine? Is it beneficial or not beneficial? Okay, and then what happens? So here the benefit is that this, when they combine, a combination of a drug is being done to show a better effect, to show the better effect. Now, what is the better effect? So here, this, when this combination, amoxicillin and clavonic acid, okay, clavonate potassium, potassium clavonate or clavonate potassium, whatever, when this is combined, it protects amoxicillin from degradation with the beta-lactamase enzyme, okay, and effectively extend the antibiotic spectrum. What does this explain? Means it shows when they both are combined, they helps each other to increase the activity. And the beta-lactamase enzyme will not get degradation of amoxicillin to place. What happened? The activity will be increased. So suppose example, if we're giving only amoxicillin and say suppose it was killing only 10 bacteria. So this is just 10 examples for explanation. Okay. So amoxicillin, when we give amoxicillin, what it was doing, it was killing 10 bacteria. But when we give a combination of that, then it may be killing, say suppose 50 bacteria. So what happened here? The activity and the action by which the drug showing the effect is increased. Okay, what is that? That is potentiation effect or synergism effect, meaning increasing the effect of a drug by combining with each other. Okay, another combination is amoxicillin with bromhexin or carbocysteine, especially in the case of patients suffering with some infection in the chest or bronchitis or bronchopneumonia or in the sinusitis, otitis, ear infection. Okay, so what it will do or what happened in there? There will be a patient will have difficulty in the breathing and the patient might have cough or sinusitis or blockage of water in the nose and the head area. So here, what could be the condition arises here? Whenever, like most common symptoms for this sinusitis and otitis or other condition is the patient will have cough, continuous cough, okay, and here difficulty in the breathing. And when the patient will put head down, means when he is lying down, okay, not lying down, when he put his head down, he feels something heavy which is hanging on his head, forehead. So in those type of conditions, this could be the best combination, shows more effect. The another is amoxicillin with chloroxycillin. It is used basically in the case of patients suffering with respiratory or upper or down respiratory, lower, upper or respiratory tract infections and urinary tract infections. Okay, especially when in the case of post-operative infection. So a patient is undergoing a urinary tract surgery, and in that case, the later on the patient is suffering with some post-operative infection on the urinary tract areas. In that case, in and in the case of gynecological infection, septicemia. Septicemia means excess of poison, acid development in the body, and bacterial endocarditis and bacterial meningitis. Another form of a drug which is used in the combination is amoxicillin with probenecide, which is used as a bacteria in the case of bacterial septicemia. If a patient has undergone a bacterial septicemia, this could be a choice of drug, and it is showing much more better effect on the skin and the softer tissue infection, acute or chronic respiratory tract infection as well. So we have few different combinations, and in the market maybe there are more available. So these are the basic combinations, which is and out of which the one what we use in the dentistry is more common is the first one, amoxicillin and clavonic acid or potassium clavonate or clavonate potassium. Okay, and the rest they all are useful, but they will be useful in different condition as we have mentioned and many more. What is beta-lactamase inhibitors? These antibiotics which inhibit the beta-lactamase enzyme or the beta-lactamase inhibitor. So what it is doing, it is basically inhibiting the enzyme. It is inhibiting the enzyme. That's why it is called beta-lactamase inhibitor, inhibiting the enzyme beta-lactamase. And what amoxicillin, ampicillin, tricillin, and piperacillin are also available in the combination of beta-lactamase inhibitors. So it can be an available combination for all this drug. Means a combination of sulbactam, tazobactam, or so potassium, clavonate potassium, or potassium clavonate. Clavonic acid is combined with amoxicillin as a brand name of augmentin and tetracycline as a brand name of timentine. And sulbactam is a semi-synthetic beta-lactamase inhibitor which is combined with ampicillin, which is used again beta-lactamase producing S. aureosa, S. influenza in the case of influenza, or in the case of producing beta-lactamase S. aureosa. In these cases, this will be given combination. Then beta-lactamase inhibitor, clavonic acid is a progressive inhibitor. It is also called a suicidal inhibitor. When we talk about this clavonic acid, it is a progressive inhibitor, or sometimes it is also called as suicidal inhibitor. Here, what it will do, basically, it will go and bind to the beta-lactamase initial irreversible, later inhibit increases with the time. And this is called suicidal inhibitor because it gets inactivate after binding to the enzyme of what? Beta-lactamase. And here it is used in the combination of amoxicillin and clavonic acid for skin and soft tissue infection, intra-abdominal and gynecological sepsis, urinary or the biliary respiratory tract infection, especially in the empiric where the antibiotics to be given in the hospital-acquired infection. So here, what is hospital-acquired infection? So here, in some cases, sometimes the patient or the people who are working in the hospital may get some hospital-acquired infection. In that case, this type of drug is very useful. The next is in the dental infections caused by beta-lactamase producing bacteria. And adverse effect. What is the major adverse effect over here? The adverse effect of this drug, this can be the adverse effect over here is this drug can causes some fungal infection, okay, in the vaginal area and in the mouth, or rashes that can be developed. And here, that's why candida, stomatitis, and vaginitis and the rashes may be developed. In some cases of hepatic injury have been reported. In some cases, hepatic injury has also been reported, but it is very rare. But the first one, the formation of fungal infection, is the most common symptoms of uh, this beta-lactamase, a combination of amoxicillin and clavonic acid drug. It is because of yes, one of the reason is that basically what happened here, whatever we are discussing about the pathogens. It's kill this pathogen, it will kill that pathogen, and it is a broad spectrum antibiotic, and it is having this effect, that effect, etc., etc. Yes, but we are not considering the basic thing. We in the body, we have immune defense mechanism, and we have some bacteria itself that is very essential for us, isn't it? So basically, that bacteria may also be affected with these antibiotics. Not only this, with all the antibiotics and maximum all the drugs, and that is one of the condition why it is causing this issue. As you said, because of the floral disturbance, it is. You're right, exactly. Okay, so that reduces the immunity and then may leads to the growth of other bacteria. But here again, this is based upon individual to individual. In some individual, you might have seen whenever they take the first dose of, like, say, suppose antibiotic like amoxicillin or penicillin or etc., anything, or beta-lactamase or anything, then the fungal infection will start. In some cases, the infection will start for the patient maybe maybe after the treatment. Like suppose the doctor, you have prescribed a treatment for 7 days, example. The infection will be there, like starts like after 5 days or 6 to 7 days, but it will go slowly. And if suppose until unless, in some cases, this can cause, we need some other medication, like suppose antifungal medication. Say example like a cotrimidazole 1% or 2%, which has to be used by the patient to overcome that condition. Again, okay, if the condition, the rashes or itching is more and severe. Okay, and any more? That's very good. And the next is drugs, which is what we are using over here for cephalosporin. The next class of drug is cephalosporin. This cephalosporin is a drug which is divided into 4 different generations: first, second, third, and fourth generation. Based upon their activity and the effect of the drug, these drugs has been designed. And maximum all of these cephalosporins can be given orally. Doctor, are all penicillin derived drugs are metabolized? Yes, 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 yes. Maximum all the drugs, derived drugs, get metabolized in the liver. So, okay, so where we have come? Okay, the cephalosporin. So what about the cephalosporin? Cephalosporin is divided into what we said, and this first generation, second generation, third generation, and fourth generation type of a drug. And these drugs are based, and all these maximum drugs are present in oral form as well as in some are available in parenteral in form of injection. But here I think this is the one which is only available in the injection form, IV dose, and that too in inpatient. Okay. So what are these drugs like cephalexin, cephalodoxil, cefazolin? Okay. The second generation drug is cefalocor, cefuroxime. This is cefuroxime 500. This is and cefexim. Okay. This is the drug which is available in the pharmacies in the hospital, which is given by the Dr. Moore, and cefexim third generation drug, and cefaloprox, the one which is from the first generation, the top one, cefadroxil. Okay, these are the drugs which is like more commonly prescribed. The cefexim here, this is available in 200 and 400 milligram. Okay, and this is an higher antibiotic. This is the drug which is given to the patient when the patient is having not responding or got resistance to the penicillin type of drugs, the drugs which is used already, and the patient is resistant in that case. And this drug, cephalosporins, we obtain it from the fungus. The name is Cephalosporium. The name is Cephalosporium, and because of that, this drug is named Cephalosporium. All the cephalosporin are here. The good thing about this drug is bactericidal. Okay, they are acting against the bactericidal, and they act by inhibiting the cell wall synthesis. It is showing the similar action as that of penicillin, the similar mechanism of action. That is also inhibiting a beta-lactamase, that is also inhibiting the cell wall synthesis, and this is also inhibiting the cell wall synthesis. And depending upon the potency, so that's why we have discussed just now, depending upon the potency of a drug, means how effective it is acting on the bacterial function, it is divided into 4 different classes. First generation have a high activity against gram-positive but weaker against the gram-negative bacteria. That is, and they are resistant to staphylococcal penicillinase enzyme. So these are the drugs. It can be resistant to staphylococcal penicillinase enzyme. But whereas the second generation drug like cefalocor, cefuroxime, and cefotoxin, these are the drugs which is acting against the gram-negative organism, and the utility is declined in the favor of third generation. So now what is here? It is acting against gram-positive and less activity to the gram-negative, but here it is active against gram-negative but less activity towards gram-positive. But when we come to the class 3 drugs, here they have enhanced activity to gram-negative bacilli, and all are highly resistant to beta-lactamase for gram-negative bacteria, and less activity against gram-positive. And ceftriaxone and cefotroxime has become an agent of choice for the treatment of condition which is called meningitis. In the case of meningitis, this could be the drug of choice. And the fourth generation drug is cefepime. This drug is used parenterally. Okay, that's why what at the time of classification means in the form of injection. It has a broad spectrum antibiotic, and it is used against staphylococcal and staphylococci type of bacterial infection. Staphylococcal or staphylococci type of bacterial infection. So this could be the drugs which is used, and here this is given inpatient, and that too it is available in the form of injection, not in the oral dose. But whereas cefexim, cefotoxime, I think this is available in injection as well as cefuroxime in injection as well as in the form of tablet, and cefalocor and the others, they are present in the form of tablet as well as some in the form of injections. But here the fourth generation drugs, cefepime, which is something which is available in the form of injection, parenteral dose only. Now coming to the microlid antibiotics. So there are three microlid antibiotic, and these are the drugs which are one of the most important drugs what we have. So example, now, so before we going to the slides, if suppose, say example, a patient is having, say, throat infection, say example, okay, I'm giving an example, a basic, and the patient is having a throat infection, say some bacterial infection, cocci, and we see some patches, and we are treating that particular patient from, say, suppose example, from last 5 days, and the infection is not getting, it is increasing or getting flare up. So in that case, what we understand that the drug, like suppose amoxicillin or maybe the augmentin or whatever the drug was given to it, given to the patient has got resistance to that. The bacteria has got resistance to that drug. And in that case, what could be the choice of drug? Then we will come to an higher antibiotics like cephalosporins or maybe something like this. Erythromycin, azithromycin, or clarithromycin. Erythro, azithro, and clarithro. Erythromycin, azithromycin, and clarithromycin. And these are the drugs which is coming available in. This is erythro is present in 250 and 500. 250 is given 4 times a day or 3 times a day. 500 given 2 times a day. Azithro is available 500 milligram. Has to be given. Azithro has to be given 500 milligram once daily, especially in the morning. But whereas clarithro is given 500 milligrams twice a day up to 5 to 11 days. This is 3 days. This can be 5 to 7 days. Now, how we decide the time duration of these drugs? Okay. So basically, based upon the severity of the infection and the condition that arises that's available, these drugs are showing effect, okay, on this particular period of time after that, okay. So a person is suffering with tonsillitis, for example, then azithromycin will be given for 3 days, or if it's not gone, and that may be continue again for 3 days. Erythro and then as clarithromycin. So this could be, these are the drugs which is used instead if the person is allergic, or those drugs what we have studied in the previous slides is resistant to that particular bacteria, what causing the problem to the patient. So in that case, we are using microlide antibiotic. And the dosage will be depends upon the severity. And with these antibiotics, here in some cases we add some antibiotic, the steroidal anti-inflammatory drugs like prednisolone or the normal diclofenac or ibuprofen with other drug combination can also be given to overcome or the faster recovery for the patient. Okay, so now coming back to the slide. So here these are the direct macrolide antibiotics divided into 3 categories: erythromycin, azithromycin, and clarithromycin. These drugs are basically acting, how they are acting? They are acting by inhibiting the ribosomal RNA. It is binding to some ribosome in the RNA. What is the ribosome in the RNA over here? What was that? Here in the RNA, there are some subunits that causes protein synthesis. Okay, there is some subunits that causes protein synthesis. Okay, if that's okay, I will try to explain you only in a short way that it is these are drugs like especially the microlide, they are inhibiting the protein synthesis in a smaller. It is a bactericidal drug. Sorry, it is a bacteriostatic drug which stops the multiplication of bacteria. Okay, and here the binding to, there are how many binding site of ribosomal area? There are three binding sites: 30S, 50S, and 70S. And these microlide antibiotics are binding at 30S RNA. But whereas what we have seen before, these drugs are bactericidal. They are rupturing the cell wall synthesis. So it is inhibiting the cell wall. So that's why it is bactericidal. Okay. But here this is also, this can also be a bactericidal. Okay. Yes, it is preventing the duplication, the multiplication of the RNA and the DNA. Okay. That's why we are not having much time. So that's why I I will explain you this process of binding and duplication, multiplication, how it is inhibited in tetracycline or the other lectures when I take that. Okay, so what we understand now, basically, just try to understand, it is like inhibiting the protein. So here it stops the protein multiplication. It stops the protein chain. How it is stopping the protein chain? So here, for example, if I am to form, this color is okay. Okay. So here what happened? To undergo some reaction, the duplication or the replication of uh, some of bacteria, means multiplication of bacteria. If suppose 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So example. Okay, this is just an example and it is not right example. Okay, so example, to duplicate the bacteria, to multiply the bacteria, we require, say, suppose example, 11 polypeptide amino acids. That is polypeptide chain, means 11 amino acid has to be stick together and forms a protein, and this helps in the multiplication of bacteria, say example, okay, just for understanding. But what this drug is doing, it is inhibiting the formation of protein synthesis. So how, what it will do, when say suppose there is a protein synthesis that took place at suppose at this stage, say example, and it is inhibited, it is the protein synthesis is blocked, and this protein will be waste now. Okay, this protein will be not used, and this is not used by which the growth of the bacteria is inhibited, and if the growth is inhibited, then the multiplication or the duplication of the cell will also be inhibited. Am I clear now? Is that okay? So this is how it is acting, this drug acting on the ribosomes and inhibiting the protein synthesis, inhibiting the protein synthesis. The erythromycin, it is widely used for both children as well as in the adults. It can be given to the children and the adults. Why? Because it is having effective against both the gram positive as well as few gram negative organisms. Means the broad spectrum antibiotic, and it can be substitute of penicillin if the person is allergic to the penicillin, and it is showing a very good or the better result in the case of pharyngitis, like here in the case of throat infection, okay, pharyngeal infection or the other infection, or UT, upper respiratory tract infection, basically. Okay, and here, what is the adverse effect over here? It will, all the pharmacological adverse effect, what is that? Nausea, vomiting, epigastric pain in stomach, and that may cause it. Because this is showing a bactericidal effect, this can show and diarrhea. Why? Because it can disturb the flora. And skin rashes, hepatotoxicity, and again in erythromycin, there is a possibility again formation of fungal infection, thrombophlebitis, and the other fewer symptoms has been reported. Okay, has been reported. So this could be very for a longer term use. Okay, and these are the most common adverse effect, and this could be for somebody it's there or somebody it is not there. Okay, but it has been seen. The next drug is azithromycin. What is azithromycin? Everybody know. Now we are giving azithromycin to so many patients to overcome some problems what we are facing at the present time. Azithromycin is available in 400 or 500 milligram once daily dose. Okay, azithromycin, it is a chemically different from erythromycin. So the structure chemically resemblance is a little bit different. And it is used in the treatment of lower respiratory tract infection and the community-acquired pneumonia and chronic obstructive pulmonary disease, meaning the patient who is having COPD, patient suffering with COPD, difficulty in the breathing and the inflammation caused in the lungs or acute bronchitis. And this is azithromycin. It could be a choice of drug for ears, nose, and throat infection like tonsillitis, sinusitis, otitis media, or pharyngitis. So in this type of condition, this is the life of drug which is used. And adverse effect is vomiting, dyspepsia, flatulence, jaundice, palpitation means problem with the hepatitis, okay, and chest pain and allergic reaction. That could be photosensitivity. Whenever the patient come in contact with the sunlight, then he or she can develop some rashes on the skin. And the last slide is about clarithromycin. So here, this is a choice of drug when all the other drugs are not working for the person who is already taken the drugs. For example, this is clarithromycin. Clarithromycin is a drug which is 2 to 10 times more potent than erythromycin. It is used in the treatment of lower respiratory tract infection and upper respiratory tract infection. So it covers all complete respiratory tract infection like pneumonia, pharyngitis, sinusitis, and bronchitis. And again, the problem will be here the GIT disturbance issues as an adverse effect like nausea, dyspepsia, abdominal pain, and diarrhea. And other side effects can be headache or the skin rashes will be seen, and hepatic dysfunction and the enzyme liver. So this is something about the macrolide antibiotics like erythro, azithro, and clarithromycin. Okay, anybody having any questions or any doubt, please ask. Any question, any doubts? Okay, thank you very much. Really appreciate your patience. We have exceeded the time 5 or 8 minutes because we started a little late because we was waiting for them, waiting for the students.